Today I want to tell you about Worldwide Hearing. Worldwide Hearing is an organization that provides access to affordable hearing aids for children and youth in developing countries. And we're very pleased to announce that we're launching our first project in Jordan early next year. Hearing loss is an invisible disability, so it's very hard to find representative images to depict it. I think these two come fairly close. Helen Keller, whom I hope you all know, was famous for being blind and deaf and nevertheless learning to communicate, was once asked which of her two disabilities was worse, deafness or blindness. And her response surprised many people. She said deafness was worse. Her exact words were, blindness separates people from things, but deafness separates people from people. And many of you would agree, I think, that what's most important to you in life are the people you care about, your parents, your children, or your best friends. So being unable to hear means being cut off from all that. And on the left, you can see the frustration on the young boy's face, the sense of isolation, the sense of being left out. And on the right, you see a group of girls at a school in Jordan. They all wear hearing aids. They all attend school. They're all friends together, and they're very happy. So for me, this is really the before and after of better hearing. Next slide, please. So why are we focused on hearing? Hearing influences everything in life, from the quality of our relationships to our ability to find work. In children, hearing is crucial to developing language and cognitive skills. Children who can't hear are at a serious developmental disadvantage. And adults with hearing loss have a higher risk of developing psychological problems, such as depression, low self-esteem, and even dementia. So to sum it up very quickly, better hearing contributes to better health in children and adults. It allows children to develop language and to learn to communicate. It allows those same children to go to school and succeed in school, get good grades, and then when they grow up, they can find work. So those are the benefits for an individual with hearing loss, but the benefits also extend to society at large. We all benefit when more people are educated, and both companies and governments benefit when citizens are able to be productive. Studies show that hearing loss is responsible for hundreds of billions of dollars in lost productivity and unrealized tax revenue every year. And that's something we want to get back. So it's in everyone's interest to support better hearing. Have the next slide, please. Hearing loss is surprisingly common. What I've included here are just the figures for what we call disabling hearing loss. And disabling, there's a technical specification for it, but to simplify it, it's basically an individual without a hearing aid who has disabling hearing loss could not perform actions that we take for granted, like having a conversation. They could not be participating in the seminar, for example. There are almost 300 million people in the world who can't hear, and most of them, 80%, live in developing countries. And you'll see on the left, I've said fewer than 1 in 40 have access to a hearing aid. That doesn't mean that 1 in 40 actually has a hearing aid. That's the proportion of hearing aids to individuals. The actual ownership number is far, far lower. So when we talk about a target market, we're talking about hundreds of millions of people worldwide. And the reason for that is very simple. Hearing care is out of reach for these people. Next slide, please. And this slide shows us why. Now, I've already spoken about the consequences of no treatment. We can see the negative effects there: isolation, mental health problems, no education, hard to find a job. This is the status quo for most people today. And the reason it's the status quo is the second column, commercial hearing aids. The average selling price of a commercial hearing aid is between $500 and $2,000 in developing countries. So it's totally, totally out of reach for the vast majority of people. It's also a very slow and inefficient process. It can take 2 weeks to get tested and fitted for a hearing aid. And there are just not enough audiologists to help everyone who needs it. In Guatemala, for example, there's one audiologist for the entire country. I mean, there are not enough people. So what about donations? Well, there are some charities that are doing this. Some large charities run missions every year where they donate huge numbers of hearing aids en masse. The problem here is that there's no follow-up. Hearing aids break, they need replacing, and when they do, and the charities are no longer there, the hearing aids are thrown away, and so all their benefits are lost. It's also often low-quality equipment that's given out, very old analog hearing aids, second-hand, refurbished stuff. People just don't wear it, we found. A lot of people keep hearing aids that are given to them in their drawers or on shelves, and it just doesn't really help. And finally, the cost of ownership is not taken into consideration, things like the cost of batteries, which need constant replacing. So it's a partial solution. It's not really a sustainable way to address hearing loss. The next slide, please. So our solution is called Hearing Express, and it basically has three components. The first, up top, is cost. We use a kit of mobile technologies that greatly reduces the cost of hearing care and which eliminates the need for doctors and clinics. So I've included illustrations of all these components. They include self-programmable hearing aids, solar rechargeable batteries, mobile hearing tests, and instant silicone ear molds. And everything here fits inside a backpack, so we can treat people even in rural areas. And this permits last mile distribution, which is a big problem for hearing care. The second component is efficiency or rapid fitting. Using this kit of technologies, we reduce the time required to test for hearing loss and fit a hearing aid to under an hour. And that allows us to treat far more people than previously possible. Next slide, please. Now, I already mentioned that there aren't enough audiologists to help everyone, but with the kit of technologies that we've assembled through Hearing Express, we have hopefully reduced the need for audiologists to fit hearing aids. So the third element is a sustainable delivery model. We establish accreditation centers in partnership with local organizations. We recruit local entrepreneurs from the local population base and train them to identify hearing problems and fit hearing aids correctly. So these individuals become what we call audio technicians, and they go out into their communities, to cities, to schools, to clinics, to villages, and they sell Hearing Express hearing aids. It becomes their livelihood. They earn a living doing this. Their presence ensures follow-up care for beneficiaries because they're always there. If a hearing aid breaks or gets lost or needs replacement, there's someone to take care of that. So this makes Hearing Express scalable and incorporates an element of financial sustainability. And the next slide, please. This looks complicated. It's not that complicated. At the top, you see Worldwide Hearing always partners with a local organization and with local governments. Our partners provide logistical help, advice, and material assistance, while governments provide equipment subsidies. Below, in the middle, you see Hearing Express. That's what I just described to you. Donations help fund the project, and we purchase our equipment from suppliers, which is then sent to the field. And below that, you see the training process I mentioned, entrepreneurs becoming audio technicians. They go out and make sales of hearing aids. A percentage they keep as their salary, and the surplus is reimbursed to Worldwide Hearing and reinvested in the project. And we use it to buy more equipment and more training. Next slide, please. So I think we're still going. I can't actually see the slide. So the obstacles and enablers for the Hearing Express, a major enabler is we have preferential agreements with manufacturers. We've done a lot of work negotiating subsidized rates. We get equipment at cost or very low cost. We've negotiated subsidies for hearing aids with local governments in Jordan, and we're really trying to take advantage of the entrepreneurial spirit that we see in bottom of the pyramid populations. Some of the obstacles we face are stigmas against wearing a hearing aid. People think it makes them look slow or different. They don't want to wear them. So we are trying to roll out awareness campaigns about the importance of better hearing and acceptance of people with hearing problems, as well as making our devices as discreet as possible. And then the big obstacle, the big challenge is ensuring financial sustainability for audio technicians. Next slide, please. So this is a simplified budget. I'd just like to point out a few things. First is that Hearing Express is highly subsidized for the moment, both by grants and donations and governments. But as you can see at the bottom, we plan to increase sales as a percentage of revenue over the next 3 years. However, these things take time to become sustainable, so we're very cognizant of that. The next is that over time, equipment represents a larger and larger part of expenses, while salary is smaller and smaller. That's a good thing. Fixed costs are relatively high in the first year and go down every year after that, and that's really the element of scalability coming into play. And lastly, we become more efficient over time. We fit greater numbers of hearing aids relative to our budgets, and the next slide explains why. So if you can have the next slide, please. We use digital hearing aids for quality purposes. An advantage to this approach is that in the digital world, equipment costs go down very quickly over time if you notice what your computer costs today compared to what it cost 10 years ago. So for an equivalent amount of money, in 5 years, we can purchase way more hearing aids than we can today, and that's really an element that's playing in our favor. And the next slide, please. This slide shows our reach over time. As we've already established what we think is very impressive baseline. We're hoping that audio technicians will be able to reach 800 people per year. But as they get better at their work and as repeat clients come back, each reaches greater numbers of people. And the next slide, please. So the success factors that will go into making Hearing Express a success are the training. We really need to ensure that quality is controlled for. We need to convince governments to support or subsidize Hearing Express. We need to be good at fundraising in the developed world. We need to continue negotiating preferential agreements with manufacturers for equipment. We need to ensure that our marketing and awareness campaigns provide sufficient clients for our entrepreneurs. And we need to rapidly adapt to changing local conditions because it will change, especially from country to country. Next slide, please. So we are a small team for the moment, but we have a lot of expertise. Our board in particular is made up of experts in health and business who've helped a lot. I just want to point out our partnership with the WHO, which gives us a lot of ins in developing countries, helps us navigate laws, import duties, and of course subsidies. Next slide. So where are we right now? We've spent the last 2 years, or year and a half I guess, finding partners, sourcing equipment, developing our programs, and creating the financial model. That's been a lot of work, but we're very close to being done. Next year, early next year, we'll be launching in Jordan, our first large-scale test of Hearing Express. And the next 3 years, we hope to scale up within Jordan and expand to 1 or 2 countries. And last slide, please. So the impact that we can have is broad. Hopefully it was implied in the early slides. Hearing has a huge impact on the empowerment of individuals, on their ability to get an education, on poverty reduction, and of course we're stimulating entrepreneurship in these countries. So this is a global problem. We're launching next year. We think that treating hearing loss has a huge social and economic return on investment. We've already secured over $350,000 in financing, and we're seeking $1.2 million over the next 3 years to create a lasting solution. Thank you very much.